The questions I'm going to ask is the same thing as any other pain in the body. Where is the pain? Where it is radiating? How severe it is on the scale of 0 to 10? Is it interfering with your function? Is there any position that makes it worse or better? And what are the associated symptoms? Then I will be making sure that we don't have red flags. That means some serious disease like cancer or infection not occurring to that part of the body. And then I will examine the person. Anytime you want to know the source of pain, you want to make sure that the range of motion in which that joint can move, it is there without any tightness, without any limitation or pain. And naturally there will also be a neurological examination, which mainly consists of basically reflexes, sensory exam and motor exam. That is how the motors part, the muscles are strong enough and there is no neurological weakness. Now there is a difference between feeling of weakness and neurological weakness. Feeling of weakness is when you are fatigued, but neurological weakness is when you isolate that muscle and you resist it manually and see whether it's weak or not. So that's one paradigm, that's one dimension of looking at cervical pain. And then comes the other paradigm in which the treatment begins before we start with any medication. Now that I call non-pharmacological intervention. All those things that can help you leading a natural life and preventing the disease. So that includes what kind of habits you have, how much neck you use in terms of laptop and screens and cell phone, and putting the pressures, and the mechanically sometime you have a history of motor vehicle accident, a workers' compensation injury, a work-related injury. So all those things have to be taken into account before you say, okay, let's do this. Now in neck, the main source of pain could be the disc, which is the structure between the two bony parts, the vertebral bones, and then the facet joints at the back of the vertebra. So on the front is the disc and back is the joints. Now these joints are lined by a membrane that is free, that has free nerve endings. It's enriched in free nerve endings. So that can be the source of pain. So after finding out the source of pain or probable source of pain, I would like to confirm it by an imaging study like X-ray, MRI, CAT scan, or electrodiagnostic study, which is a functional study, how the nerves function. And I'm going to go into detail of the usage of these diagnostic modalities. Once I find out that this is the source of pain, before prescribing a medication, an injection or surgery, I will medication, and sometimes I'll combine it with medication so that I break the pain cycle and correct the defaulty posture, the weakened muscles or the tightened muscles. So in this way, that paradigm will be corrected. The third paradigm is that when I will prescribe the medication. So in that paradigm, I would like to mention what kind of anti-inflammatory medication you can use, what kind of pain medication, what are their side effects. If we do the injections, what is their side effects, what are the probability, what is the actual purpose of that injection, and then if everything fails, should we go for surgery or can we go for surgery even before that? So all these modalities I will be discussing in upcoming vlogs.